Welcome back to Coffee Talks regarding collaborative dental hygiene practice. This is Coffee Talk number 3, where we'll continue to unravel more mysteries.
Yes, I'm pleased we could get together again and talk about collaborative dental hygiene practice in community settings. In our last conversations, we identified resources that were helpful. We talked about the model and its requirements, and then we touched on supervision, scope of practice, and some of the important protocols that will help to be included in the collaborative agreement. So let's continue our discussion today as we unravel more challenges.
Good idea. And I hope that the issues that we're discussing are making collaborative dental hygiene practice more understandable. To start out today, I thought it would be a good idea for us to assure that our viewers are really understanding that there are multiple ways in which a collaborative practice model can be implemented. For example, Minnesota Statutes 150A.10 uses a statement actually, that says, dental hygienists licensed under this chapter may be employed or retained by. And that statement has caused a lot of inquiry from people about what does that really mean. So first of all, licensed under this chapter purely means just that it's Minnesota state law. And the employed word typically involves payment for services provided by that dental hygienist. But then the term retained by, which is a little bit more confusing, that was intentionally inserted into the law in order to allow authorization for dental hygienists who want to be engaged in collaborative practice in either an unpaid or a volunteer way of carrying out the model. And the most common way for collaborative practice to be involved is when a dental hygienist is employed by either a community setting, a nonprofit clinic, or a qualifying dental clinic. For example, dental hygienists engaged in school sealant programs or in long-term care settings. They usually use portable dental equipment. But as far as the employment goes, a dental hygienist who is employed to work in a community setting is compensated for the care that they provide the same exact way that those same procedures would be compensated if they were working inside of the brick and mortar walls of a specific dental practice. And an individual dental hygienist may also develop a community-focused program that is separate from a specific dental practice. This requires a lot more steps to go through. It requires that dental hygienist needs to develop a nonprofit organization status. And they also need to designate a board of directors. So my thinking and recommendation is always to seek expert advice when they're exploring that model, and in particular to be really careful about following the legal guidelines. So a couple opportunities for assistance with that we know of is a group called SCORE, which is a nationwide network of volunteer business mentors who provide meetings and workshops and a lot of resources either at no cost to the person seeking the help or at a very low cost. And then another much better known group is the Minnesota Council for Nonprofits, which also help businesses develop a nonprofit organization, and they too, even though it's a membership organization, there's a very low fee for belonging to that organization. So both of those are great places to check if you're looking for that type of model.
Well, that's a lot of information. I appreciate the guidance you've given our viewers on that too as well. You know, another thing that comes up often on the business side of collaborative dental hygiene practice is the issue of liability.
Yes.
And the law doesn't speak directly to this. There's nothing in the language that states who is liable for the patient outcomes. But as with any clinical situation, we assume that it's both the dentist who's collaborating with the dental hygienist as well as the dental hygienist who is responsible for patient outcomes. So there really is no mandate for a dentist or a dental hygienist to carry liability insurance. And often dental hygienists are covered under their employer plans. but we highly recommend that a dental hygienist carry their own liability insurance, even if they're covered under their employer. There are good reasons for that.
Really important information on that, Jean. And on a similar note, another question that is brought up frequently is the collaborating dentist responsible or mandated by law to be the provider for the follow-up treatment that is identified by that collaborative practice hygienist? And the answer to that is no. There is no mandate for that, but it was an intentional provision to include that in the Minnesota statute to encourage dentists to sign on to become part of this collaborative practice model. And we've mentioned previously that providing the protocols inside that collaborative agreement are really important. And in fact, the statute requires that certain protocols are required to be written explicitly. So I believe that it's imperative that the team do all they can, even though it's not mandated that the collaborative practice dentist be that treating provider, that the team help in as much of a way as they possibly can to help that patient secure follow-up treatment, and if possible, ideally, to circle back and to find out whether that treatment has actually been completed. And in some cases, that collaborative dentist actually might be able to provide the follow-up care that's identified by the dental hygienist.
And that really would be ideal. That's an excellent point you make, and it's very important for dentists who are interested in collaborative dental hygiene practice to know that. So thank you for that. In 2017, a new provision was added to the law that allows dental assistants now to work with a collaborative dental hygienist in that setting, which is really exciting because we feel that it's going to really increase the services that are provided to patients in a more timely manner. So the law specifically says some things about this, and one of those things is that the dentist supervises the dental assistant under general supervision, which again means the dentist does not have to be on site. We've also consulted with the Minnesota Board of Dentistry in how that dental assistant should function. And the recommendations are that the dental assistant protocols for authorization and services provided also be included in the dental hygienist's collaborative agreement. And this is where they prefer that information goes. So again, review the law for the mandates that it suggests, and also the language for collaborative agreement for specifics that can also be applied to dental assistants.
And really important for clarifying. And as we discussed about written protocols, with my working with school-based dental sealant programs, one of the required protocols to be written is around sealant placement. And I find that it's important that the protocol be very clear, because in school sealant programs, the dental hygienist is the person who does that assessment and makes the recommendation about which teeth should be receiving sealants. And following that assessment, then a licensed dental assistant is able to then place the sealants. So that addition of services for the licensed dental hygienist in 2017 really will make a difference on access to care, and it's a significant change to the protocols and the ability for collaborative dental hygiene practice.
Yeah, and that's another great area that I'm glad that you clarified for us. In addition, there was more good news in 2017 in that now there is not a clinical experience requirement for dental hygienists to participate in this model, which means that our new graduates can be dental hygienists with a collaborative agreement.
Really nice.
And this, we hope, will increase the numbers of dental hygienists that initiate new practice settings with this collaborative agreement. So we are hopeful that our new grads will choose over traditional practice, collaborative practice, and bring those services to people who do not have access to oral health services.
Very good, very nice. And there are a lot of obstacles that we have tackled and that we need to tackle. We've come a long way over the years, and we need to find ways to increase the viability and the utilization of collaborative dental hygiene practice, because we need to more intentionally also move that dental health into medical health for that medical dental collaboration. We need to think more about health issues and healthcare trends, and also about the newer technologies that continue to arise in our profession. So please join us as we continue the discussion about collaborative dental hygiene practice. And until then,